Hey everyone, this is Rachel Wall, founder of Inspired Hygiene, and this is my first official solo Facebook Live. A little bit nervous, you know what you say here, you can't ever take it back. And I'm sure we'll repurpose this for our weekly newsletter as well. But I wanted to talk a little bit about periodontists and general dentists and their work together. And one of the things that we're seeing, we're starting to do some work with periodontal practices and helping them with their hygiene department to really figure out how they can take that to the next level and really refine their systems and things like that. And it's been really interesting and very enjoyable. And one of the things that we've seen a lot as we're doing analysis of these hygiene departments is that very often the periodontists do not bill out an exam, a doctor exam. And there are a couple reasons for that. One reason is sometimes we've heard that they are under the impression that that is included in a periodontal maintenance. And then what we share with them is that several years back, the ADA changed that CDT code so that those are now two separate codes, the 4910 and the exam. And then the other thing that we hear sometimes is that they are reluctant to charge the exam because they do not want to take that benefit away from the general dentist. That if the patient has two exams as far as an insurance benefit per year, that they don't want to use one of those and then the general dentist, you know, is not able to utilize that. So here's how I have been coaching them, and would love to know what you think about this. Is I think when you are beginning your relationship with, or even if you're already in an established relationship with a specialist, and then with a general dentist on the other side of it, is it's important to make sure everyone is really clear on what that working relationship is going to be. And it's great if you can set that up early on. And if not, if this is already an established relationship, then maybe take that other dentist out to lunch and say, I know there's some confusion around this. I'm learning this, and here's what I would like to propose. And perhaps if the patients are alternating, each of you charges an exam once a year, because certainly the periodontist is doing a periodic exam and that needs to be documented. And so here's the thing, periodontists, if you're listening, is even if you don't wish to charge out for a periodic exam, bill it out at no charge. At least have something in the ledger and in your clinical notes that clearly documents that a doctor exam was performed. For your records, for your protection, for the patient's records, just all around a really good idea to make sure that you do that. But what would really be ideal is if the general dentist could bill out an exam once a year, and the periodontist could bill out an exam once a year. Because certainly they're performing these procedures and they're using their skill and judgment to determine what is in the patient's best interest as far as moving forward. So I feel like it's appropriate for both practices to be able to bill. The other option is that you each bill out two exams and you educate the patient ahead of time that that's what's going to happen, right? That there may be two perio maintenance and two exams that are out of pocket. That certainly is also appropriate if the dentist is seeing that patient, twice a year in the general dentist, twice a year in the periodontist. I think the line bill for what you do is always appropriate. And so it's important for everyone to be able to perform their duties and to be able to be reimbursed for that care that they're delivering. So just a thought on whether or not periodontists should bill for exams. Would love to know what you think, and look forward to hearing more from you about it.